Assalamualaikum warahmatullahi wabarakatuh, and good day everyone. Okay, thank you for joining me today. So today I'm going to present a little bit about um, my area of research, which is chemical from plants as a source of drugs. So when we are talking about chemicals from plants, okay, first of all, I would like to introduce myself. I'm Cik Puteh from Aurins and Faculty of Applied Sciences. Title of my talk today is Chemicals from Plants as a Source of Drugs. So when we are talking about chemicals from plants, we cannot avoid from talking about natural products. Public usually perceive natural products as something free from chemicals, organic and natural. But the actual fact is not. Natural products refers to small molecules or small chemicals compound produced naturally by any living organisms, including primary and secondary metabolites. Chemical from plants are usually referred to as phytochemicals, as natural products may be isolable in small amounts and have interesting biological activity and chemical structures. Natural product synthesis poses an interesting challenge in organic chemistry. All right. Um, if we found a natural product from plants that has therapeutic uh, values as well as interesting uh, biological activity, we need to mass produce this compound. Unfortunately, some of natural product present in very small quantities in natural sources. That means we need to reproduce these compounds by other techniques such as organic synthesis. But natural products usually have complex chemical structures and sometimes they have more than one stereoisomers, which poses an interesting challenge on organic chemistry. These quotes were taken from nature.com. In a simplest form, natural product is a molecule or chemical entities produced by a biological source. For example, plants, marines, microorganisms, endophytes, fungi, and many more. So, in a research landscape, what is natural products? Natural products are a central theme of research at the interface of chemistry and biology. But against this backdrop of significant scientific advances in understanding the chemistry and biology of naturally occurring small molecules, there is a need for increased public awareness of what it means to be natural. Okay, this quote is taken from chemical biology. So there are some classes of compounds, for example, flavonoids here, that usually gives vibrant colors to plants and our food. For example, we have here naringenin, resveratrol, as well as ternatine A1 in pea flower. Okay, this ternatine A1 is a type of anthocyanin subclass flavonoid that gives the blue purplish hue color to pea flower. In addition to anthocyanins, there uh, that gives the vibrant colors to our food. There are other class of compounds that gives colors, which is betalains. Interestingly, plants that produce betalains, anthocyanin, do not produce betalains and vice versa. So the picture here are some examples of natural compounds that produce betalains, which gives the vibrant colors to the plants. We have here beetroot and bougainvillea. So plants usually produce secondary metabolites. So plants usually produce secondary metabolites via a specific chemical reactions or known as biosynthetic pathway. So these secondary metabolites productions in plant, they are very specific to a certain genera and family. So the plants that have the capacity to produce betalains do not have the same capacity to produce beetroot. So basically, there are two types of natural products, which are primary metabolites and secondary metabolites. So primary metabolites are produced by primary metabolism. So primary metabolism is a chemical reactions and chemical processes that are essential for the growth of living organism, which without those, the living organism cannot survive. For example, plants produce primary metabolites by photosynthesis and other chemical reactions to produce primary metabolites, for example, carbohydrates, amino acids, and fats. And plant use these primary metabolites as precursor to secondary metabolism processes. So precursor means they are using this primary metabolite as a building block to synthesize a second type of natural product, which is secondary metabolites. And secondary metabolism is important for the survival and adaptational mechanisms of the living organisms. For example, defense against disease. Example of secondary metabolites are alkaloids, flavonoids, quinones, terpenes, and not limited to what is listed here. These are some of the examples of secondary metabolites. So why plants produce secondary metabolites? Okay. Plant produce secondary metabolites for various reasons. Some of the reasons are pollination and seed dispersal, feeding deterrence, defense against herbivores and pathogens, as well as produced in response to stress. So, for example, capsaicin in chilies. We know that when we take a certain amount of chilies, it will give the hot sensation. So this is due to capsaicin binding to the TRPV, a receptor in human and mammal. So normally the herbivores will avoid chili plants due to the presence of capsaicin. However, capsaicin will not affect birds, which when birds consume chilies, it will allow the chili seeds to be dispersed at the further away from its original plants. So capsaicin, a plant produce capsaicin as a seed dispersal as well as feeding deterrence. Another reasons why plants produce secondary metabolites are as a plant-to-plant communications, protections against harmful environment, and to attract the predator of the enemy of the plants. For example, plants produce volatile we usually calls them as essential oils, the one that gives flavor and fragrance. So plant produce a volatile organic compounds as a means of plant-to-plant communication, as well as to attract pollinators for pollination. In addition, it can also attract the predators of the plant's enemy, which means the predator will actually give some sort of give protection for the plants against its enemy. So how plants produce secondary metabolites? Okay, the illustration here shows a simplified version of chemical reactions in plants, where plants use them to synthesize secondary metabolites. Okay, this one is already a simplified version which shows almost all kinds of chemical reaction. But this diagram should be a simpler version to illustrate how plants produce primary and secondary metabolites. Okay. Plant produce primary metabolites via primary metabolisms. Okay, and the primary metabolite is used in the secondary metabolism, which is the chemical reactions to produce secondary metabolites. Such as here we have phenolic compounds, okay, a type of secondary metabolites. We have alkaloids here, and we have terpenes. Okay, so plant is actually one of the source of natural products. Plants is a source of vastly diversified chemicals. They are important source of pharmacologically active compounds. Many have found their ways from tree to bedside. Okay, this pie chart and diagram is taken from an article published in Phytochemistry Reviews. Okay, this pie chart shows the compositions of natural products identified from natural sources. To date, more than 200,000 of natural products have been identified from nature, and many of them come from plant kingdom, followed by animal kingdom and fungi. From plant kingdom here, we can see from the chart here, many of the natural products identified are of the penoid class of compounds, followed by alkaloids and flavonoids. And we can see many drugs that we use today are actually from this class of compounds. And uh, and here, okay, this pie chart is taken from an article published recently in Journal of Natural Product. Okay, this paper summarizes the drugs that have been registered from 1981 to September 2019. We can see here there are several types of drugs that have been registered since 1981. Okay, we have biological macromolecules, for example, proteins and peptides, and we have and here uh, and here okay, unaltered natural products. That means these natural products were isolated from natural sources, and their structures, their chemical structures are never altered or modified, and they were developed, okay, uh, from the discovery from natural sources to prescription drugs. Another classification of drug here is a botanical drug. Okay, botanical drug is actually a mixture of one or more herbal medicine. Okay, it was introduced by the US FDA in 2012. This kind of drug requires us to identify the active substance, and we need to standardize the active substance to make sure that the consistency of their compositions in the herbal mixtures. Another class of drugs here we can see is natural product derivatives. Okay, natural product derivatives are the drugs that are produced from natural product natural product that have been derived either by semi-synthetic or full synthetic, but the structure are from the natural product skeleton. The other class of drug here we have synthetic drug. They are produced by total synthesis and by random uh, by random mix of the pharmacophore based on combinatorial chemistry and other approaches in drug development. The other one is synthetic drug, but by using natural product pharmacophore. They may be produced by total synthesis, but the development begin with the natural product pharmacophore. The other one is vaccines and mix of natural products. Mix of natural products are usually ligands that bind to the human protein receptor or enzyme, and uh, uh, they are uh, they are produced by starring this ligand and by competitive inhibition. So basically, from the pie chart, we can summarize that 40% of drugs registered from 1981 and until 2019 are the derivatives of natural products. Okay, actually from 1981 to 2019, there are 1,881 drugs registered based on that reported in this paper. And from this, 40% of anti-cancer drug, 60% of anti-diabetic drug, 55% of antibacterial drug, 60% of anti-parasitic drug and 79% of anti-glaucoma drugs are the derivatives of natural products. So these are examples of drugs from plants. We have here paclitaxel or Taxol. It was isolated from Taxus brevifolia. Back then, when the National Cancer Institute, USDA, they carry out uh, a program of large random screening to find a new anti-cancer drug when they found Taxus brevifolia. And then phytochemical study on the Taxus brevifolia yielded paclitaxel or Taxol. However, paclitaxel uh, present in Taxus brevifolia in a very small quantity. So in order to mass produce paclitaxel, the scientists actually isolated the precursor or building blocks of paclitaxel from common U, which they can isolate them in abundance. So paclitaxel is produced by semi-synthesis of the building block that are isolated from common U. It is now used as anti-cancer agent. And the other one is quinine from the stem bark of cinchona. The decoction of the stem bark of cinchona tree had been used as for the treatment of symptoms related to malaria for centuries. It was not until 1822 when French pharmaceutical chemist isolated quinine from cinchona bark. It was used as anti-malarial agent for treatment of malaria until 1920s when the Plasmodium parasite started to develop resistance against quinine. The scientists then did modifications on the structure of quinine to produce chloroquine. Chloroquine was used as for the treatment of malaria until the 1990s when Plasmodium parasite began to develop resistance against chloroquine. I believe many of us now hear about this chloroquine compound since it is considered as one of the compound in clinical trial against SARS-CoV-2 infection among the COVID patients. In the 1990s, artemisinin was used for the treatment of malaria when a Plasmodium parasite developed resistance against chloroquine. So artemisinin was found during artemisinin was isolated from Artemisinia annua. Artemisinia annua is a herbs used in traditional Chinese medicine for the treatment of fever. Back in 1967, natural product scientist Tu Yuyu from China conducted a large random screening to find a new anti-malarial agent from herbs used in traditional Chinese medicine for the treatment of fever or malaria when they found Artemisinia annua. Artemisinin was isolated from Artemisinia annua in 1972. Today, artemisinin combination therapy is used as standard therapy for the treatment of malaria, which caused by the infection of chloroquine-resistant Plasmodium falciparum. And this compound here is vincristine. It was isolated from Cantharanthus roseus, or commonly known as kemunting Cina. Initially, they study pokok kemunting Cina for new oral hypoglycemic agent for treatment of diabetes. However, they found out that this plant did not show good potential as oral hypoglycemic agent. Later on, when they study the alkaloid fractions of pokok kemunting Cina, they found out that the extract, the fractions suppress the bone marrow. Then later on, a further phytochemical study yielded many vinca alkaloids. One of them is vincristine. So vincristine is one of the early generation of chemotherapy agent. It is an anti-mitotic agent. It kills cancer. It kills rapidly mitotic cells, and one of those cells are cancer cells. This is a chemtoticin. It was isolated from Chemtotica acuminata. It is one of kind that inhibit topoisomerase 1. Okay, Chemtotica acuminata is a plant that is used traditionally in traditional Chinese medicine for the treatment of cancer. Due to some issues with the bioavailability of this compound, modification of this compound produce topotecan that currently used as anti-cancer drug. Okay, this is theophylline, okay, type of methyl xanthine compound that is found in the tea leaves. Okay, in 1 gram tea leaves, there is about 1 milligram of theophylline. Theophylline is one of the earlier bronchodilator drug that is used for the treatment of asthma and COPD. Okay, so this is digitson, which was isolated from Digitalis lanata. It can also be found from other plants from Digitalis genera, for example, Digitalis purpurea. So digitson is one of the medication used for heart problem. And this one is galantamine, which was isolated from plants in the Galanthus genera. Okay, galantamine was the early generation of um, Alzheimer drug. So why natural products are an interesting approach to drug discovery? They have diverse chromophore, and many important drugs today are found from nature. For example, artemisinin, quinine, salicylic acid, vinca alkaloids, taxol, and many more. In addition, we can benefit the ethnomedicinal knowledge in our research. Some of the drugs that we use today are actually found from plants that uh, were traditionally used in traditional medicine, even though it is not always true for all cases. For example, in case of kemunting Cina that I have explained just now, uh, uh, pokok kemunting Cina or Cantharanthus roseus was used in Madagascar for the treatment of symptoms related to diabetes. But when the scientists investigated the plants, they found out that the plant did not have potential as anti-diabetic agent. In addition, natural products have unique chromophore. Even though natural products structures may not obey the Lipinski rule, but we can see that many drugs that come from natural product do not actually obey the Lipinski rule. So this is some of the interesting aspect of why natural products an interesting approach to drug discovery. In addition, due to its diverse chromophore and unique chromophore, they are used as the skeleton and pharmacophore for further in the drug development study. So this diagram illustrates a very classical approach to natural product approach to drug discovery. Nowadays, we have many approaches to tackle this area. This is just an example. Okay, it begins with the selection of plants. There are various factors of why we select a particular plants. It could be due to simply a total random screening. For example, we have identified one receptor or protein that we want to find new inhibitor. We can screen the plants, and plants that show good activity will be further investigated for their active substances. Whereas some plants are selected based on the basis of their traditional usage. So we actually review to the old scriptures or by interviewing people, and then we can identify which plants that are used traditionally for the treatment of certain diseases. Okay, and then after we have selected the plants, we will perform plant collection, identification, and authentication. Often there are cases where plants have quite similar characteristics, and without the identification and authentication of the plants by using modern technique or by consulting the botanist, we might collect the wrong plants. And then the extract or the pure compounds from the plant screen for biological activities based on a certain target. Okay, and then the compounds or the extract will be further studied, okay, for their to develop the heat that we found here, heat compound that show good activity, and then to develop into a lead candidate. And usually some compounds that we need to mass produce, we need to synthesize them. So here we need to collaborate with synthetic chemists. So we have other technique that we can use. But this one nowadays with the modern technique, we can do this very fast and no longer doing the classical isolation technique. These are example of the flows, how it was carried out back then. So basically, the process is very much similar to other approaches. It begins with the target identification and validation. So it involves hundreds and thousands of natural products, and after dereplication and prioritization, all these several will be isolated and will be characterized, and their structures will be characterized. And then after the further development of the compounds, several compounds will be mass produced by synthesis or semi-synthesis to scale up, to mass produce the compound and to scale up productions. And only several compounds will pass through all those studies, including to investigate the toxicity and the mechanisms of actions, ADME, and many more until one will be chosen as a candidate for clinical trial. So whatever that I have been discussing just now, they are the reductionist approach, in natural product approach to drug discovery, which involves identification of single active compounds. Let's say I have found an extract with a certain biological activities, and then I will try to find the active substance and scale up the production of that active substance for further evaluation. The single active compound drugs have simpler metabolism routes and has single biological target. However, the production can take a long time due to the scale up hurdle and also many other processes here before it can finally become a candidate, drug candidate for clinical trial. And one of the challenges in this approach is the availability of the drug in poor nations. Often, poor regions cannot afford to have this drug because due to long processes, the drug can be rather expensive and they cannot afford it. So I will explain in the next slides on the case of artemisinin, where finally people try to use its original plants in order to treat malaria in the endemic region. So now we have other class of drugs as introduced by US FDA in 2012, which is the botanical drug. Botanical drug involve a mixture of one or more herbs in a medicine. So basically, it involves identification of several active compounds, and this and then whatever the therapeutic effect of these herbs is due to the presence of active substance. So it is important to actually quantify and standardize their presence in the herbal preparation to make sure that the composition is consistent between batches of productions. So it involves standardization of extract. Begin with the plantation of the plants, collections, processing, drying, and packaging. Because the way we process the plants, how we dry, how we collect, when at which maturity stage will affect the composition of compounds. So this process needs to be standardized to ensure that the consistency of composition of this active substance in the extract. This process is faster and cheaper one way due to we don't need to actually scale up the production of active substance. And plant extract may have hundreds to thousands of compounds, and this involve multiple biological targets when we consume this herbal preparation. So it can be quite challenging for the scientists to find out, and it also have complex metabolisms. But luckily today, with the new technology, omics technology, scientists are able to elucidate these pathways and metabolisms. So some of the challenges of this approach is reproducibility. it is important to ensure that the composition of active substance in the plant extract is consistent. If not, its therapeutic values cannot be reproduced. So this is one of the challenge, given the fact that plants normally produce slightly different metabolites when they are exposed to different stress factors. Another challenge is sustainability. Certain plant can take quite some time to mature, and sometimes we need a large clearance of land area in order to plant these medicinal plants. So it is this is one of the challenges in the holistic approach. So this is one example that I can find. Okay, cough medicine here we have beta-expectorant, which have one active compound, and then we have this one, another cough medicine that contain a number of herbs with a known composition. So having said that, a drug must have safety and efficacy profile, and it must undergoes all these evaluation processes, including toxicity, ADME, contraindication, and drug interaction, standardization of the extract for the case of herbal preparation and clinical trial. So I will discuss about artemisinin. One of the, I think, interesting example to see, which was initially artemisinin was purified from Artemisinia annua in 1972. Okay, and then it was used as anti-malaria drug in 1990s due to the emergence of chloroquine resistance. And today, artemisinin combination therapy is used as standard therapy for malaria treatment. The scientists that discovered artemisinin, 2UU, received Nobel Prize in Physiology or Medicine in 2015. She is the only natural product scientist that ever been awarded with such award. However, in the poor regions, especially the sub-Saharan region where malaria is endemic, they cannot afford artemisinin for all their patients. As compared to chloroquine is much cheaper as compared to artemisinin. So, not to mention that many countries in the African region have lack of access to healthcare facilities. So, scientists propose the use of dry Artemisinia annua or tea infusion for malaria treatment in poor countries. So we can find in many scientific journals reporting on several countries in Africa continent planting this Artemisinia annua. So they are investigating their chemical, the presence of active substance, which is artemisinin, and also the composition of other compounds as well. Even though the composition of artemisinin in Artemisinia annua is very small, it's not enough to give the therapeutic value, which is to inhibit the growth of Plasmodium falciparum. However, they found out the presence of other phytochemicals that have weak anti-plasmodial activity in the dried leaves enhances the bioavailability of artemisinin. There are a number of case studies reporting that when they gave dried leaves of Artemisinia annua, the parasitemia of the patient reduced, comparable to artemisinin combination therapy. So there is ongoing research on the standardization of Artemisinia annua, and also the randomized control trial on the use of tea infusions and dried leaves for the treatment of malaria in African regions. So basically, one may ask, if plants contain natural products, okay, which were previously reported to have certain biological activities, will the consumption of their tea and or extract give similar effects? Well, the answer is yes and no. And we come back to the basic principle of toxicology, which is the dose makes the poison. So basically, why plants may not be consumed as medicine. Okay, again, it comes to dose. Even though I mentioned just now about artemisinin, but we cannot say that the situation might work for other plants. Okay, often natural product in plants or other natural sources, okay, that have therapeutic values present in a very small quantities in plant samples. Okay, and then we are not sure yet either that is enough to give that therapeutic value. And the second is the dose might actually be affected by the variation of secondary metabolites due to different factors. Okay, for example, if I have two same plants, okay, let's say I have mastotec, for example, the one that I plant in nursery and the other one grows in the wild. Okay, the one that grows in the wild might to compete for their own um, nutrients or sunlight, and also need to protect themselves against predators and other factors that may affect them. Whereas the one that is planted in nursery, okay, they may be given adequate nutrition, okay, water, and they may be protected against predator. So the one that grow in the wild might produce slightly different secondary metabolites in response to that stress. So this is very important when we want to produce medicine from herbal, from plants or any other natural sources. We need to do standardization of the uh, the active substance that present in the plant sample, as given example just now on artemisinin. As I have discussed about artemisinin just now, the presence of other substance, for example flavonoids, they actually enhance the bioavailability of artemisinin. This is something that we call positive synergistic effect, but it could be the other way around. The presence of other metabolites could reduce the therapeutic potential of that active substance. So this is why it is important to investigate and to standardize the active substance before one can be registered or used as medicine. Another issue is bioavailability. Often we see certain natural products are modified prior to formulation as drug due to bioavailability issues. So this is something that need to be investigated before we can say, oh, this plant can be consumed in what form for the treatment of certain diseases, because uh, the um, uh, because or else the therapeutic values cannot be delivered. And in case of chronic patients, patients with chronic disease, they normally take some form of medications on daily basis. So when they want to take herbal supplement, for example, as co-treatment for their diseases, it is advisable for them to discuss with their doctors first, because some herbs can cause drug herbs interaction. Okay. In addition, the use of herbs without first consult a doctor may pose risk of herb-induced liver injury or HILI, especially among the patients with chronic diseases. So this is why when before any drug can be say that it is safe and efficient, especially in terms of herbal medicine, they must undergo a proper study so that uh, their safety and efficacy can be established. So, in addition, there are actually some natural products that are used as drug today, uh, actually originated from poisonous plants. One example is metformin, dimethylbiguanide, that was modified from guanidine. Okay. Guanidine was initially isolated from Gallica officinalis, the poisonous weed that okay. And then when they found that these guanidine, okay, do not have good toxicological profile, uh, modifications of the structures, giving several candidates for several lead candidates, including dimethyl biguanide, or today commonly known as metformin. So metformin today metformin is used widely for the treatment of uh, type 2 diabetes. So as a conclusion, okay, natural products are chemicals produced by living organisms. So and natural product from plants or chemicals from plants are commonly known as phytochemicals. And about 50% of drugs today are actually derivatives of natural product, especially anti-diabetic drugs, anti-cancer drugs, okay, anti-glaucoma drugs. All right. And there is a new class of drugs called botanical drugs made up from standardized herbs. Okay, which means the herbs must be subjected to extensive study before we can say that it can be used as prescription drugs. Even though plants may contain biologically active compounds, they may not be effective and safe to be consumed as medicine. Having said that, okay, for certain plants that are commonly used as food, for example, priakatot, bitter gourd, or bendi, and a few others that people usually say that by consuming these particular uh, ulams or vegetables, it can reduce postprandial hypoglycemia. Okay, this shouldn't be a problem for them to actually take this kind of ulam in the form of ulam, of course, and not in the form of herbs, capsule, and everything. But they need to observe if they had some hypoglycemia to be on the safe side. Okay, so I think that's all from my talk. So let's see if you have questions.
Thank you, Dr. Cik Puteh, for the informative and interactive presentation. Now we open for any question from the participant.
Okay, I see
Excuse me.
question from Marina Abdullah. Okay, actually I'm not the right person to talk about the suitable grow for the mascote. It requires other form of expertise, the one that works with the plants. So basically, they have ways to measure the amounts of, let's say, what type of soil I want to use, and um, uh, amount of sunlight and that kind of thing.
Excuse me, Dr. Cik Puteh.
Yeah.
I'm a dentist by profession, but I'm quite interested in some of the herbal studies for oral
Okay.
health. I know that if we were to go for the lab study or antibacterial study, if we were to go for the herbs itself, that's take a long time, as you say, and a lot of procedures. But we will be informed that we can go for the active ingredients and know the name of the active ingredients
Okay.
and where to purchase it, sort of. Can you advise me as far as UiTM is concerned regarding these active ingredients? Can we go to you, or we have to go to the one in USA? Given the
Okay,
address.
actually, maybe you can email me later with what is the name of the active compounds and from which plants. But for, I think for oral for I think for mouthwash, do you mean for treatment of some disease relating to oral health, is it?
Yeah.
So I don't know about that. I don't know either the study, I mean, in terms of standardization, will be as complex as something that we need to consider. I'm not very sure about that. But if you want to know, either we can produce this compound, maybe you can email me later and then we'll see.
Yeah, it depends whether I get the money or not. Thank you very much.
Okay.
Thank you.
Okay.
All right.
Is there any more question? Okay, we have question from Fanelia Anak Francis. Okay. This is the thing that actually I write in social media from time to time to actually educate public about the danger of taking unknown herbs. What I'm talking about unknown is sometimes people claim that this contain this particular herbs and blah blah to say that it gives certain effect. But the truth is I'm not very sure. Okay, because in Malaysia the regulations regarding herbal preparation is not actually similar to botanical drug in the US FDA. We have the traditional medicine registration, MAL, and the 8 numbers and T. They are not regulated like botanical drug. If I want to produce a herbal product, I just need to submit the to investigate for a few things only. For example, the contents of heavy metal, the microorganism count, the they will analyze for the adulteration of the schedule poison, and another one they will investigate on apa benda tu lagi, I forgot. So this only these four. You don't need to submit like evidence, clinical trial and all to prove that it works. So that's why when some people ask me, I always advise them listen to their doctors, because we don't want people to take medicine that might not work, especially the traditional medicine that might not work. Actually, it doesn't work. It doesn't cause harm either. But because they don't take their medication as prescribed, it can cause complications due to the disease itself. So I think this is culture that people prefer something that they understand is natural, but they assume that it is free from chemicals, but the truth is not. Okay, plant produce chemicals, sometimes they can be quite harmful. So yeah, I understand it's quite difficult actually. So the best thing we can do is we educate people on why you need to take your medicine, and your medicine is not totally synthetic. Sometimes they actually produced by bioengineering, for example, of the active substance. So even though it is synthetic, they has gone through all the safety study. So I hope I answer your questions.
Any more question? Any more question? Okay, Cik Puteh, we have another question.
Our health teaching. Okay, actually I'm a chemist. Okay, I'm not a suitable person to answer this question. So since my study is on natural products, so it involves interface between chemistry and biology. So I have some knowledge on this, a little bit knowledge, but I'm still a chemist by a profession. So I'm not the right person to actually explain. But generally, on social media, there are groups of healthcare professionals that keep educating people on about these myth about misinformation in the social media. I myself, as a natural product chemist, normally I will tell them that there is no such thing as a plant free from chemicals or organic. Organic is actually agricultural practice. It has nothing to do with free from chemicals or natural at all. And then uh, we will educate about the level of evidence. I mean, if I do research at discovery level, at the ground discovery work, or some lead development, it is not yet ready to say that it's safe to be consumed. Something that public they don't understand when they read journals. So I think for health teaching, maybe this one is not the right question for me. So do we have other question?
Okay, Dr. Cik Puteh, I just want to ask some question. What's
Okay.
your opinion about functional food formulated with herbal plant?
Okay. So as far as I'm concerned with the NPRA, okay, there are some distinct line between functional food and drug. So dia duduk di tengah-tengah, somewhere in the middle. So there are some definition actually by the NPRA where they want to investigate, is it food or is it medicine? So we need to actually refer to these guidelines by the National Pharmaceutical Regulatory Regulatory Agency. So they are the one that regulate the registration of drugs. And then the food actually falls under the FSQ division, food and safety, food safety division, quality food something bahagian kawalan makanan or something. So they're different. So to say that food is food, to say that they have certain certain therapeutic effect, for example, they might need to refer to akta ubat periklanan dan jualan, okay, to make sure that they don't actually break any law, because there are certain health claims that you cannot do, the 20 diseases untuk for penyakit and also for other forms of untuk makanan, food and drinks, as well as other classification of drugs, for example, supplement, traditional medicine, traditional medicine, drugs registered under MALNT. This kind of registration, they cannot make health claims. Contohnya, to treat diabetes, to treat cancer, to treat hypertension, to treat asthma, to treat obesity, or to treat the 20 diseases altogether. So that's why it can be quite tricky. It can be like, something that revitalizing your health or anything, but it does not cure certain disease. So anyway, we need to refer to NPRA guidelines. Okay, recently I read in the newspaper that NPRA is going to introduce another classification for herbal medicine. That one is for high claim traditional medicine. So they need proper study, that one. The one that we have here, they don't classify. The one that we have now, MALNT, they don't differentiate between high claims and low claims of traditional medicine. But I don't know about the implementation of that yet. But I've read somewhere early this year. Okay, about the formula to convert dosage from Dr. Muhammad Nazri, dosage from in vivo study to human. Basically, I'm a chemist. I don't involve in clinical research. So if I want to do clinical research, I normally work together with my medical researcher counterpart. So I cannot answer this one. I don't know how to calculate in the first place. Okay.
Okay, on behalf of the NCPI office, thank you so much for joining us today, and have a great day for your rest.